there might be a way of doing the one-day TMS in such a way that we can target the same circuits as Ibogaine without having to put people through the ordeal or the danger of Ibogaine. Years ago, nobody would have thought that you could just reset opioid addiction with a 24-hour intervention, or you could reset 2 decades of PTSD or depression or anxiety, or that you could do this in veterans with severe brain injuries and concussions and so on. So the idea that that's even possible just shows what the brain is capable of under the right conditions. Please, let's put this under a giant disclaimer of very early, not even published yet, preprint research. The same Stanford group that developed Saint also did a very influential study on Ibogaine called Mystic. Both they protected the heart with magnesium, and then they gave the Ibogaine. But to your point, people still undergo this extremely intense, up to 24-hour plus, psychedelic experience. It takes a lot of time to integrate afterwards. What was very important about the Stanford studies is they also collected brain imaging, and they also collected EEG recordings of the brain to see if they could figure out some changes in brain activity that were accompanying the improvement part. Look at who gets better and who doesn't, and then look at what changes are happening in the people who improve but fail to happen in the people who don't. There's a preprint out from one of the groups at Stanford who analyzed this data. Well, what's going on in the brains of these folks when Ibogaine is successful? I was somewhat curious about what the results of this would be because when I've spoken to other clinics who have been experimenting with the precuneous treatment as well as our own clinic, we just keep seeing the same profile. People are saying that this sounds a lot like Ibogaine. Like, yes, it's just TMS and nobody's having hallucinations, but their PTSD symptoms are getting better, their anxiety symptoms are getting better, their depression symptoms are getting better. And I was saying to myself, I wonder if Ibogaine could have something to do with the precuneous, because when we do precuneous TMS, it seems to be kind of people describe very Ibogaine-like stuff with it. So sure enough, the areas of the brain that were showing the biggest changes in activity were right under the precuneus. Again, it's a preprint. It's not even peer reviewed yet. It's all really, really, but to me, it opens up the possibility that there might be a way of doing the one-day TMS in such a way that we can target the same circuits as Ibogaine without having to put people through the ordeal or the danger of Ibogaine, which would obviously be really, really nice. TMS is already FDA approved. So it's interesting to see that. And again, this is something we'll have to, I'm hoping in a year or two, we'll have better data on this and figure out. So I'll just phrase it in the form of a question. Is it possible that a TMS coil combined with D-cycloserine could engage neuroplasticity and do a lot of what Ibogaine is doing, but in a more tolerable way that's sort of safer and uses stuff that's FDA approved now rather than many years from now?